My name's Rick Hershberger. I'm a vascular surgeon in Sarasota, Florida. Welcome to Whiteboard Wednesday, where today I'm going to talk to you about what to expect after you've had a procedure on your arteries. Sometimes with wounds to the feet, we're able to treat those blockages, treat the problems in the arteries with balloons, catheters, and wires. Typically that procedure lasts an hour and a half. Sometimes we have to put stents in. When I perform that procedure, I'll see you about a week after to make sure you're doing well, to make sure the location of where we had the catheter doesn't have any issues, and to make sure your blood flow is truly better. That can be done with a simple physical exam. Typically about a month after the procedure, we'll get an ultrasound looking at the blood flow and making sure whatever I ballooned, whatever I stented is still working as well as we want it to. All the while, you'll still be undergoing wound care at the direction of either your podiatrist, internist, wound care center, or sometimes I help you in taking care of these wounds. A typical course from procedure to healing of a wound is around 2 to 3 weeks, sometimes a little bit longer. If you have an open surgery where I have to do a bypass, typically that's done with several incisions which have staples in them. So once again, after the procedure, I see you about a week later, take staples out, examine your leg, and make sure the bypass is functioning based on exam. Just like with the stents, then we get an ultrasound to make sure the bypass is still working and doing well and that there are no issues. Once again, expect a 2 to 3 week course before the wound has completely healed or is showing signs of improvement. In both cases, whether a stent or a bypass, I will then see you regularly to make sure your circulation is doing well, as well as check other areas of potential circulation concern, namely the carotid arteries, which might put you at risk for stroke. So the long and short of it is whether you get a bypass, a stent, or balloon, I continue to follow you regularly to make sure your circulation issues are optimized, to make sure your wounds are healing, and to make sure you have no other vascular issues that need addressed. Once again, my name is Rick Hershberger. I'm a vascular surgeon in Sarasota, Florida. Thank you for seeing Whiteboard Wednesday. Any comments or questions about how we deal with your arteries after a procedure, please feel free to leave them below. Thank you.